Welcome back to another episode of Beyond the Shot. Today we have amidst us Dr. Shilpa K, our clinical head and lead physician at Stepcare. Welcome, Dr. Shilpa K. And today we are going to be talking about one of the most influential viruses in the viral world, influenza. So, influenza gets the term influenza, and more influential than all of us all over here, from an ancient Italian saying, which means or which goes like influenza di freddo, which means the coming of the winter, which also addresses the season of the cold and the season of the flu. And today we'll be going on the journey to know about influenza and what we can do to save and protect ourselves from this most influential bug. So, Dr. Shilpa, thank you for being amidst us for this influential episode.
Yes, Dr. Soni, thank you so much for inviting me to this podcast. Indeed, it's high time that we start talking about this particular influential virus, as you were saying, because considering the amount of respiratory illnesses around and the mortalities and morbidities that it holds, it's very important that we educate people regarding each types of viruses and the different kind of diseases. So influenza is a good place to start, is what I would say. And thank you so much for inviting me to this.
So, Dr. Shilpa, just for the benefit of everybody over here listening to us, our very eager listeners, what is influenza or the flu all about? So, all of us know it's a virus, and so how different is it from the other viruses that we have, like the common cold? So, is it the same as a common cold, or is it something more influential and more sinister than the common cold that we all keep harboring now and then?
Correct. That's a very, very good question. I mean, us being physicians, we encounter a lot of people coming in with symptoms like, the cold, sore throat, cough, and breathing difficulty, these kind of things. Now, there are common cold. There are a lot of people who have the doubts whether this common cold is the same as the flu. Why are we taking the flu shots? If I take the flu shot, will the common cold will not occur again? These kind of doubts are very common, so it is very important to address this. The common cold, as we all know, is usually caused by 40% of it is caused by rhinoviruses, and there are other respiratory viruses also which plays a role, which are respiratory syncytial virus and coronavirus, etc.
Yes.
But usually the common cold is caused by rhinoviruses. These
Correct.
are, as you all know, it will have usual symptoms like the runny nose or sore throat, cough, these kind of minor symptoms. It takes its own sweet time and it just goes off.
Yeah, as they say, common cold, you take medicines, it lasts for 7 days. If you don't take medicines, it lasts for a week.
Exactly. You
So-
see the doctor or not, it takes its own sweet time and
Correct.
it just goes off. That is how the common cold works. But when it comes to influenza is a respiratory illness caused by a respiratory virus called as influenza virus. Now, there are 4 types of influenza viruses that we need to know. There is A, B, C, and D. Now, A and B are the ones which are known to cause epidemics, the seasonal epidemics.
Correct.
As you said, it is something which comes during the winter.
Correct.
I could get the Game of Thrones reference also. The winter is coming, influenza is also
Yes.
coming. But C and D, C usually causes minor illnesses, but influenza D causes infection in cattle. It doesn't usually spread to humans.
Okay.
So the influenza that we are talking about is caused by A and B.
Okay.
Now, the influenza A is the one which has, all these viruses have a lot of proteins in them. You would have heard H1N1,
Correct.
H5N1, H3N2. There are different kinds of flus that you all know, swine flu, avian flu, that
Correct.
flu. So this H and N are the proteins that are present over the viruses. These proteins are hemagglutinin and neuraminidase. But nobody has to know about this, but the H and N comes from the protein markers which are present over the virus's body. So that is something that it's good that people know. So these things, they undergo mutations with time, and that is why there occurs different variants of this influenza viruses. So that can cause the epidemics with time to time.
Okay, ma'am. Thank you. That was very insightful from you. Ma'am has spoken at length about the flu and various epidemics, and we are all reeling after the pandemic that has struck us the entire world over, the COVID pandemic. And taking you 100 years ago, we also remember the Spanish flu or the Spanish pandemic, which was in fact caused by something like a similar virus to the influenza virus. So, flu has been as sinister or more destructful than any other world wars that we've ever seen. So, talking about all these sinister viruses that are so deadly and can almost wipe off humanity from the face of the earth, what can we do within our capacity to safeguard ourselves against these menacing viruses?
Good. That is a very important question. So the protection that we need to get can be individual as well as on a community level.
Okay.
So on an individual level, what we can do is maintain proper personal hygiene,
Yes.
which includes washing our hands frequently, especially when we are sick with fever, cold, cough. Because what happens is influenza, as it is influential or contagious, it usually spreads by something called as droplet infection. So droplet, as in when you sneeze or you cough, the droplets which contains the viruses will enter the air. Now, if somebody else is in close proximity with me, they might come in touch with this droplets, or they might touch the surfaces which has these droplets, or if they use the towel that I used unknowingly, or that way the viruses can enter their body as well. So, because this is contagious, it is very important that we wash our hands frequently, wash the towels that we are using frequently with warm water, use a mask. These kind of personal hygiene techniques needs to be followed. That is at the individual level. In case of community level, the primordial protection is via vaccination. So, influenza vaccination is something that everybody needs to take.
Okay, so definitely protecting ourselves is our responsibility majorly by personal hygiene and other measures that Dr. Shilpa said. And vaccinations, definitely, we are also accustomed to vaccinations ever since the COVID vaccines have come into our lives. So you just mentioned about vaccines, ma'am. Is there a particular brand of vaccine that I should take or a particular form of vaccine? What is the demographic that people should consider using these vaccines? Is there a particular age group that should definitely be taking these vaccines? So definitely our listeners would love to hear all about this.
Yes. So the influenza vaccination should be taken more than 6 months of age. Anybody who is more than 6 months of age needs to take the influenza vaccine, and it should be taken yearly. Why yearly is because, as I mentioned, the viruses can undergo mutation from time to time, and their strains keep on changing. So we need to add that particular strain to the particular vaccine each time. And now we have something called as a quadrivalent vaccine, which is available, which has 4 variants of influenza viruses, mainly 2 of influenza A and 2 of influenza B. That is available in the quadrivalent vaccine. Now, there are different kinds of vaccine. Inactivated vaccine. Inactivated is when it is actually a live organism, but it is inactivated so that it does not cause illness just like flu, but it will give more immunity. So this vaccine needs to be taken yearly, more than 6 months of age. Now, people who are more than 65 years of age and less than 18 years of age are more prone to these illnesses, considering the immunity is a little on the lower side. Also, people in between these ages also who have other serious illnesses or chronic health conditions like that of asthma or COPD, if you are a chronic smoker, or if you have a heart disease or other diabetes or hypertension, chronic lifestyle diseases which can hamper your immunity, these people are also prone to getting diseases frequently. So they should also vaccinate themselves with flu vaccine yearly.
So that's again a very interesting piece of information that the demographic is widespread from as less as 6 months to probably 65 and beyond. So it practically endorses vaccinations for everyone across the board.
Yes.
So what I'd like to know is, like, there are different forms of vaccination. There's a nasal vaccine available. There's an injectable vaccine available. There are probably intramuscular needle-free vaccines. And then there are different strains of vaccines. So there are NH strains, SH strains. So is there a particular strain that people from India or Asian should prefer? Is there a predilection for us to develop a particular type of influenza? So, which vaccine and which administration of vaccine would be more beneficial for our people?
We do have different kinds of vaccine considering the different kind of studies and trials that we have conducted. Like you said, there are nasal vaccine, there are inactivated vaccine, there is recombinant vaccines. And now all of this provide adequate amount of safety. There is no, I wouldn't suggest anyone to go to only this kind of vaccines, but however quadrivalent vaccines available these days, which are injectables usually, and that doesn't cause a large amount of side effects or so. It is very minimal. Maybe just at the injection site you may have pain for a while and it'll just go off. There is no particular allergic reactions per se, unless you know you are allergic to eggs or so. But even in that setup also, people do give vaccination, provided you are in a clinical setup where there are doctors around you who can help you out. So I wouldn't suggest a particular type of vaccine to anybody. Only if you take this can you get the immunity. However, what is available is usually the inactivated live attenuated vaccines that are usually given, and it's given yearly. Yeah.
So, is there a chance of people developing flu after getting the vaccine as such? So, most people who come to get vaccinations are indeed apprehensive of getting the vaccine because they feel that the vaccine can inoculate the bug in them.
Yeah.
So, in case of influenza or the flu vaccine, is there a possibility of the same?
No, it's not possible because, as I mentioned, the vaccine that we are giving is live attenuated. So even though it does have the pathogen or the kind of viruses that can cause the disease, but it is inactivated, so that it cause, even if it causes anything, it will cause any mild little bit of fever, low grade fever or so, but it cannot cause the full blown influenza. So there is no chance that you will get influenza out of an influenza shot.
That's really interesting.
Yeah.
So vaccines have indeed come a long way from the 18th century when Edward Jenner first started his experiments on trying to eradicate smallpox by indeed injecting smallpox into different people who could volunteer, and to the development of the first flu vaccine in 1935, where actually inactivated bugs and not live attenuated monovalent vaccines were indeed used to try and benefit soldiers of World War II. And from that, we have really gone a long way in developing such state-of-the-art vaccines that can actually do people a world of good.
True.
So I believe that indeed vaccination is definitely the way forward for not only protecting ourselves, but to protect our tomorrow. So is there any other benefit other than protecting ourselves from the flu bug? Do we get some cross protection? So if I take the flu vaccine, can I protect myself from COVID or any other diseases?
That is a very important question. Ideally, the flu vaccine will protect you only from influenza usually.
Okay.
It does not protect you from, if you take the flu shot, it does not mean that you will not get the common cold. It does not mean that you may not catch COVID at all. So the flu shot does not protect you from COVID. It is not a replacement for COVID vaccine or any other disease per se. However, you can take a flu shot and a COVID vaccine on the same day. You can take flu vaccine and pneumococcal vaccine on the same day. That is possible. But other than that, a flu shot usually prevents from these particular strains that you have taken. You will get an immunity from influenza. Yeah.
So I definitely can take the flu shot, and I think all of us who've missed our flu shots and COVID shots should be going for it. So if I am to take the flu shot this year, you told me I have to take it every year. So that is my biggest deterrent from the perspective of a patient. So, like almost every other vaccine is taken probably once in 3 years, once in a lifetime, once in 5 years, once in 10 years. Why is the flu so worrisome? And even the flu vaccine is even more worrisome. Probably there are people over here that would rather suffer and tolerate the flu for a few days than come and get themselves poked every year.
Oh no, because the complications that comes from the disease itself is way more than the pain you get from one tiny shot taken once a year. You don't want to experience the whole illness and the ICU and all the mortalities which comes with it. So I would definitely suggest everyone to still go for their flu shot and suffer a little bit of pain every year. The thing with annual vaccination is mainly because of the mutations that I told you, especially the influenza A is very prone to changing itself again and again. I think there are still trials and studies going on regarding developing a vaccine which would work for even longer time, so that we can, maybe make it 2 years or 3 years down the lane. But for now, it is annual vaccination, and please suffer the pain until we have a better option.
Okay, I hope that once in 2 or 3 year vaccine definitely comes out much sooner.
Yeah.
Otherwise, all the kids who are really already tormented by all these needles, I'm really sure they really do not want to be coming in for their flu jab year after year. Man, it was a very insightful session. So, as a take home message, would you strongly advocate the use of influenza or flu vaccines for everybody in a specific or vulnerable age group? Or would you, as a healthcare provider and as our clinical lead, definitely say, please do go for it, no matter what your health condition is?
Yes, Dr. Suneet. So I would definitely recommend influenza vaccine to everyone more than 6 months of age, but most importantly to all those who are vulnerable to this disease, especially as I mentioned earlier, the ones below 18 years of age and people more than 65 years of age, considering their immunity can get low, and also those who have chronic lifestyle diseases like diabetes, hypertension, asthma, COPD, these kind of illnesses. I would definitely suggest the vulnerable group to take the influenza vaccine on an yearly basis.
Okay, thank you, Dr. Shilpa, for that wonderful insight that you've given us. So, just to, for an insider's view or for a perspective, if you were in a position of power, if you were made Healthcare Minister of India for a particular tenure, would you mandate this vaccine not only to create a healthy today, but to forge a healthier tomorrow? Would this be a mandate by you?
Yes, definitely. I would definitely mandate the use of influenza vaccine.
We've heard it from our lead's mouth. Definitely, it is going to be mandated if she is health minister. I'm sure all of you are going to be rooting for that. So am I, and so are all of us here. So thank you for joining us for a wonderful episode of Beyond the Shot and Protecting Tomorrow. Stay safe, stay healthy, and for more insightful episodes, do follow us at Stepcare. And do not forget to get your flu shot today.